Hello, my name's Rob Christley, and today I'm going to be presenting some of the work that we've done looking at aspects of social support and its impact on the management of dogs during the COVID-19 pandemic in the UK. I'd just like to start by thanking all my co-authors who are listed here. As of late last month, the UK had seen more than 6.5 million cases of COVID-19, resulting in over 132,000 deaths. In the early phases of the epidemic, the focus of national control efforts was on the restriction of behaviours, primarily through lockdowns. So these closed non-essential workplaces and shops, it restricted access to outdoor activities and exercise, and prevented contact between people. So as well as the obvious impacts to people, it was anticipated there would be numerous impacts to dogs. For example, many people were spending much or all of their time at home with their dog. There was a single exercise period outdoors allowed per day per person early in the pandemic. There are clearly restrictions on travel, which might prevent travel to preferred walking areas. And there was closures of boarding kennels, dog walking services, and veterinary services, as we've just heard. Our previous work has identified a wide range of impacts on dogs. And this, for example, has included impacts on walking and the time the dogs have spent playing or being trained by their owners. For example, we found that most dogs were walked less often and for shorter duration, but that this effect was minimised when there were more adults in the household and where additional people could be recruited to help walk a dog. So we're interested in this aspect of the social network around the dog and the impact that it had on its welfare. So the aim of this study today is to better understand the impacts of a lack of support or a perceived lack of support for dog management during COVID-19 lockdowns in the UK. We conducted an online survey during lockdown 1, which was the strictest lockdown in the UK. The survey was open from the 4th to the 13th of May, and the end of the survey coincided with the easing of restrictions from lockdown 1 that allowed unlimited walking for household members. In this survey, just under 4,000 respondents provided information on the support available to them. The follow-up survey was conducted during a period of change in the UK. Following a substantial easing of lockdown restrictions from June 2020, October saw an increase in cases of COVID-19, with the introduction of a three-tiered system of restrictions across different regions in the UK, although none of these were as severe as the first lockdown period. And this commenced on October 14. Survey 2 was conducted just prior to a second lockdown that began on November 5th, and the survey ran from the 5th of October to the 2nd of November. We assessed the availability of support based on two questions about support for walking dogs and care of dogs, respectively. Respondents could indicate that they had already accessed support, that they knew they could or were likely to be able to access support, and that could be from within or outside their household, or that support was not available or was probably not available. And these latter two responses were used to identify people that we coded as having limited support. Logistic regression was used for analyses, and this was multivariable as appropriate. So during lockdown, overall, just over 10% of respondents reported that they had limited support available for their dogs. Among these, almost half reported that they had limited care for walking only. 11% reported that they had limited support for care for their dog only, and about 41% indicated limited support for both care and walking. So what were the characteristics of people reporting limited support? So multivariable logistic regression indicated that people with limited support were more likely to be older, that's older than 55 compared to our reference group of 18 to 34-year-olds. They were more likely to be male compared to female, and they were more likely to be living in a single adult household compared to households with more adults. The number of children in the house was also associated in the univariable analyses, but as this was correlated with the number of adults, it was not included in the final model. In addition, limited support was more likely for older dogs, particularly those in the adult category, and where there were 3 or more dogs living in the household. Respondents who reported limited support were also significantly more likely to agree with the following statement, that if living alone and with no help available to care for my dog if I was away, I would delay hospital treatment to care for my dog. So compared to those with support available, which is this group here, those with limited support were more likely to agree, and largely the difference was that there were fewer people in the undecided or unsure category amongst the limited support group. Perhaps this indicates that these people had already considered this possibility, or that the hypothetical question that we posed was more closely aligned with their own experiences. There was also evidence that limited support was associated with respondents' feelings about their dogs. Those with limited support were more likely to report being worried about getting enough food for their dog, the cost of keeping the dog, and also what would happen to their dog should something happen to them. In contrast, there was no significant difference in the extent to which respondents indicated they were happy to have the company of their dog, that they were more relaxed when the dog was with them in their house, or that they were worried about accessing veterinary care. Although I think these results should be interpreted with some caution due to the wide confidence intervals, particularly for those people with limited support. Comparing responses between the initial and follow-up surveys, it was clear that there was considerable change in the availability of support for some people. It should be noted in this figure that people who reported that support was available both during and following lockdown are not shown. 41 people who reported having support available during lockdown subsequently reported that it was not available for walking, care, or both. Of the people who had reported support for either care or walking was unavailable during lockdown, a substantial majority of these reported that it was available during the follow-up survey, perhaps suggesting that these people were reliant on boarding kennels, dog walking companies, or distant or previously shielding family and friends for this support. In contrast, while 50% of people with limited support for both care and walking reported that this was available at the follow-up survey, 1 in 3 reported that both were still unavailable, perhaps suggesting longer-term issues such as social isolation. Within our follow-up survey, relatively few people reported that they had experienced a need for support and were yet unable to access this. We estimated that about 0.5% of people were unable to access support for care for their dog when they needed it, and about 0.25% of people were unable to access support for walking their dog when it was needed. However, recognising that there are almost 28 million households in the UK, and about 23% of these have a dog, we estimate by extrapolation that around 30,000 households may have had unmet needs for support with dog care, and about 16,000 may have had unmet needs for support with dog walking. Using a previous estimate of around 1.4 dogs per dog-owning household, this equates to about 42,000 and 22,000 dogs affected by limited support for care and for walking, respectively. The likely selection biases inherent in this study makes these figures somewhat uncertain, but does suggest that there were substantial unmet needs during lockdown 1 in the UK. So, in conclusion, we found that many people, about 1 in 6, used support for walking and care during lockdown, and I haven't shown this data in this presentation. But we did also see that about 1 in 10 people reported a lack of access to such support. Now, while this resulted in a relatively small number having unmet needs during the pandemic, it was likely that many thousands of both dogs and people were affected by this lack of support. Now, the numbers did decrease from lockdown to post-lockdown, yet the persistence for some suggests that this may be an ongoing problem for them. The lack of support likely had negative impacts on both human and dog well-being, and it suggests that social isolation may have animal welfare impacts. This may be more common amongst older people, amongst males and those that live alone, and particularly those with older or greater numbers of dogs. So we suggest that these findings suggest that further investigation of One Health and One Welfare approaches to social isolation is warranted. So thank you all for listening. I'd just like to acknowledge all the people that helped us by completing our surveys, and up here are some links to publications related to this work. Thank you very much.